My understanding about the dentist's role in the healthcare is that they promote oral health to the patient by preventing and treating oral problems.
I understand that dentists play a crucial role in healthcare by focusing on oral health, diagnosing and treating dental issues such as cavities, gum disease, and oral infections. They also provide preventive care, educate patients on proper oral hygiene practices, and contribute to overall health by detecting systemic diseases with oral manifestations like oral lesions.
The role of dentists in healthcare has the same weight as those in the other allied health programs, just like how it is important in the field of radiologic technology, medical technology, nursing, because what dentistry has in store is all focused on dental health care, not just what we perceive as something aesthetic when it comes to taking care of our teeth, but also its functionality. It is important when we think of dentistry that way.
My understanding of the role of dentists in healthcare is that dentists promote oral health care and provide services that help prevent tooth decay or any problems related to that. And they also provide services that address every patient's oral health care need. They play a very important role because I believe taking care of our oral hygiene means taking care of our overall well-being. They help not just in keeping the aspect of our health good, but also brings back the lost confidence and self-esteem that was affected by oral problems. Tooth or gum problems, I believe, if not checked, could lead to a more serious disease, so it is really important to see a dentist.
So my answer with that is, well, having diagnosed with rheumatic heart disease, I realized that dental health is the foundation of overall physical health. This being said, the role of dentists in healthcare is huge and sometimes underestimated. If more Filipinos would prioritize dental health, I'd say we might have prevented 70 to 80% of common illnesses and diseases.
Yes, I was able to work with a dentist before when I was still an intern in the Talamban Health Center. And I was the one who dispensed medications to the patients, for example, mefenamic acid and antibiotics.
Yes, there was this patient who was in a coma for about half a year, I guess, and the collaboration with the dentist included oral care to a comatose patient by the means of suctioning oral secretions and then using cotton swabs, mouthwash, and water irrigation for the patient's oral hygiene thereafter.
No, I haven't collaborated with a dentist yet since I just recently passed my medical technology licensure examinations last March 26. But of course, I am open to the idea of collaborating with a dentist in the near future.
I haven't collaborated with a dentist in patient management because as a medical technologist, my primary role is typically focused on laboratory testing and analysis rather than direct patient management. But there may be instances where medical technologists work alongside dentists indirectly, such as coordinating laboratory tests related to oral health conditions. Collaboration in patient management would depend on the specific healthcare setting and the nature of the patient's condition.
Not yet, but I would love to if given the chance, especially that I work in HR, the HR field. Would be good to have dental health webinars and seminars for employees.
No, I was not able to collaborate with a dentist in other professional contexts.
Yes, as a nurse, I have collaborated with dentists in various professional contexts. So this collaboration often occurs when caring for patients with complex health needs, where oral health plays a significant role. We work together to ensure comprehensive care plans, share patient information, coordinate treatments, and provide support to patients and their families throughout their healthcare journey. Because sometimes when a nurse is not available in the area, or not available to provide oral care, a family member can perform it as long as a nurse teaches the family member how to do the proper oral care.
So like what I said in the previous question, I haven't collaborated with a dentist or in any other profession yet since I just passed my licensure examinations. But again, I'm hopeful that I can collaborate more with other healthcare workers and even the dentist because it's part of our job.
I haven't yet, but in certain healthcare settings, I believe there can be collaboration between medical technologists and dentists, especially in research or clinical studies involving oral health and dental related conditions.
In relation to item number 2, I haven't yet, but would love to be given the opportunity.
As a pharmacist, I envision myself to collaborate with the dentist in the patient care by educating and managing the medicines that the patient will take. For example, their antibiotics and their pain relievers that they will take when they have oral health problems.
So in the sense of improving well-being of a patient, it is significant for a dentist and a nurse to collaborate on the patient's oral care needs. Just like the comatose patient I handled, the doctor would order suctioning for the mouth secretions and then provide oral care after to ensure patient comfort and safety as well as promoting health.
But of course, during my internship years, I have experienced many patients going through the lab and those patients had their CBC checked because what I know, what they said is that their dentist asked them to take a CBC before any major dental surgery or procedure because, of course, when there's a dental procedure, there's always blood in the concept, diba? So if you would be normal, then it would be okay for you to take the procedure, or if not, then you will go in another time because if any of the results are low, hindi siya pwede. So I think that's a good start as I become a registered medical technologist in the laboratory setup soon. I hope that I can also deal with that procedure, and hopefully any other things that the dentist would recommend their patients and ask me to do that.
As a medical technologist, I could help the dentist by performing laboratory tests as part of routine health checkups to identify potential issues early on or before a dentist performs a risky procedure. This collaboration could enhance patient care by integrating expertise in both fields to address oral health comprehensively.
Well, by promoting employee wellness through dental health and hygiene.
Reflection. After conducting all of the interviews, I have learned that interprofessional collaboration plays a crucial role in ensuring comprehensive care and promoting overall well-being in patients. The interviewees' answers made me realize that dentistry is not an isolated field, rather it intersects with various disciplines such as pharmacy, nursing, medical technology, psychology, and physical therapy. Each professional has a specific role in the interprofessional approach of dental care. The pharmacists collaborate with dentists in managing and dispensing medications to patients. The nurses assist dentists in assessing patients' overall health, identifying risk factors, and coordinating care across different healthcare settings. Medical technologists provide laboratory support to dentists, which helps in knowing systemic conditions of patients that may affect their oral health. Psychologists help dentists in managing dental anxiety, stress, and phobia in patients. Physical therapists help dentists in restoring the function, mobility, and alleviating pain in musculoskeletal system, such as in temporomandibular joint or TMJ disorders. To summarize, interprofessional collaboration in dental care yields numerous benefits, enhancing both patient outcomes and the overall quality of care. Through interdisciplinary teamwork between dentists and other healthcare professionals, comprehensive treatment plans can be devised, addressing not only oral health issues but also their systemic implications. This collaborative approach fosters a holistic understanding of patient needs, promoting preventive measures and patient education. Moreover, it facilitates the sharing of expertise and resources, leading to improved treatment outcomes, reduced treatment costs, and increased patient satisfaction. By integrating various perspectives and skills, interprofessional collaboration in dental care ensures a more efficient and effective delivery of services, ultimately enhancing the overall well-being of patients.